Here at Back on Track, it is my mission to talk about your disorder and to show you that you're not on your own and to lead you to the correct professional help you need. Depression, and what is it? Well, depression can make you feel low, it can make you feel unwanted, and it can make you feel as though everything is so much harder than realistically it is. When depression comes severe, it can be terrifying, and what I mean by that is it can lead us to act on impulses which in the end can lead to unfortunate suicides. In 2014, the Adult Psychiatry Morbidity Survey established that 3 in 100 people in the UK suffer with depression, and 8 in 100 suffer through a mix of depression and anxiety. Just remember that no matter how low you are feeling right now, there is help and support available, and the treatment that is out there can differ from person to person, as not everybody's going to react the same. No matter what you're experiencing, there is definitely a treatment out there. With depression, there are so many symptoms, and I'll list quite a few. You may be able to relate and you may not be able to, but that's okay, because your symptoms are your own. You may feel sad and worried and feel upset. You may feel guilty or worthless. You may feel restless and irritable. You may feel angry or numb. You may be lacking in confidence or are suffering with low esteem. You may be unable to enjoy the little things that used to please you before. You can feel helpless and you can feel hopeless. It can lead to feelings of anxiety where you're constantly worrying, and at the end of the day, unfortunately, it does lead people to have suicidal thoughts. And even more unfortunately, there have been people out there that do act on these thoughts and unfortunately are no longer with us today. And that's what I'm aiming to change, by being able to talk about these disorders and relate to you and show you that it doesn't have to be that way, because I've got through it. You may well even behave differently. You may well avoid people and social interactions, even with those that are really close to you. You may find it hard to concentrate and function at work or school or college. You may find it extremely difficult to perform clear and conscious decisions. And you may experience memory loss or difficulty to concentrate in lots of situations. And lots of people do suffer with psychosis, and this means that you hear and see things that aren't actually true. Your doctor may diagnose you with depression and say whether it's mild, moderate or severe, or you may well be diagnosed with a specific form of depression, and I will cover these in the description below. What leads to our depression? Well, it can be an accumulation of factors such as genetics and physics, difficult childhood experiences and stressful life experiences such as a loss of job, bereavement, loss of relationship and loss of friends, or could even be stemmed from bullying or a victim of crime. There may well not even be an obvious cause, and getting support. Now, I know it can be a very scary experience, or you may even be in denial, but your best bet is to speak to your GP. The very first step, speak to your GP. Many people will wait a very long time to do this, but the sooner you go, the better. If you have been suffering with depression for a very, very long time, then you may feel like it's just normal and part of your everyday life. But try and stay open to change. Be positive about taking that step, because at the end of the day, you can be better. A common treatment for depression can be a variety of talking therapies, talk group, self-help tips and medication. The right treatment for you will depend on the severity of your depression and the type of depression you have. Self-help resources are very easy to gain access to, and they may even be enough to help you. They include self-help books, online cognitive behavioural therapy and group exercise classes. The NHS website has more information about how you can access more self-help tips. Talking therapies include talking confidently to a therapist and speaking about your worries and your feelings. There are many therapies recommended for depression, and this includes CBT, so cognitive behavioural therapy, interpersonal therapy, psychotherapy and counselling. Your GP will recommend which one they feel will best suit you at the time. And if you live in England, you can even refer yourself to therapy. Unfortunately, the NHS do have long waiting lists. However, you can go privately if you can afford this, and I'll put another link in the description below to help recommend some talking therapies for you. Medication. There are plenty of different medications to tackle your depression. It may not work on the first try, and it does take a little while to kick in, but it's about being open and honest with your doctor about whether you are feeling the effects of this medication, and if not, they can recommend another one. It's about that slow journey, about finding that correct one that has the most positives for you. I'll also put a link to more information on antidepressants for you in the description of the video. So ways you can look after yourself. Well, this involves taking steps that lift your mood and help towards recovery. Talk about how you're feeling with people in your close bubble and to your GP. Eat well, eat a healthy diet, stay physically active and spend time in nature. Get outdoors and appreciate it for what it is. Avoid cigarettes and alcohol. Consider mindfulness, a technique you can learn to fully engage yourself in the present. And try talking therapy. Talking to a professional is the best way to be able to overcome your illness. And they may be able to know and understand what is going to be best for you. And thank you to everybody supporting me on this journey. It's given me a massive sense of achievement to get myself back on track and to get you guys back on track. Afoa. And as a last note, as somebody who's been diagnosed with depression, I can understand your disorder. If you want to relate to me more, then watch my video on Depression and I, where I talk about my struggles and my issues and what helped me get through and to get back on track.